Okay, number 21, you are up.
So this one's clean up the clutter, part 2, front office.
I think that's cheating. You did.
So front office, those stacks of papers, those sticky notes, they're everywhere, right? Or the signs taped up on the monitors with the NPI numbers and the tax ID numbers and all of these things, all these different reference points and insurance phone numbers in the back behind the monitor, all of that. At some point, when a patient is traveling through their appointment, at some point they're going to get a view of your space, right, where you work. And so getting that as clutter-free as possible is absolutely the goal. So, and of course, we also have to pay attention to HIPAA. And so we want to make sure that there's nothing with patient names on it that they can see from anywhere that they might be observing your workstation. So, yep.
There you go. Okay, she cheated. She used 2, but that's okay.
Hey.
It's important. Trust me, I know. Okay, good. So then mine is going to be look around, and Andrea kind of talked about this earlier, but what can the patient see from wherever they are? And many times the break room, the kitchen, the doctor's office, the locker area, the sterilization area, patients can see that. And I know we get busy and you fall behind in sterilization. I know at lunch, everyone's trying to get in and use that microwave and there's 5 people waiting. I know the doctor has 6 lab cases he has to check, but find a way to keep it out of the eyesight of the patients. If you have to, we had in our office glass doors so that it seemed open and airy, but there were 2 doors we ended up frosting, and one was the kitchen and one was the doctor's office, because those were the 2 areas when everyone's trying to go to lunch at once, it can get crazy and it can get dirty, and we didn't want the patients to see it. So be conscious of that and find ways so that for eyesight for the patients, they don't see the clutter, they don't see the mess.
Mm-hmm.
All right, 2 seconds early. All right.
Job.
Okay, up to you.
All right. Clean up the clutter, part 3.
You're cheating.
So everywhere, this is everywhere in the office. If you need to have it at your fingertips, it either needs to go in a drawer, because we're keeping that horizontal space clean, right? So it either needs to go in a drawer or go vertical. I think a lot of offices could forget that vertical real estate. And so there's all kinds of really great wall mount file holders. And of course, in the back, there's the glove holders and Kleenex holders and all that stuff. But we have brochure holders, we have shelves. So in the back or in the front, rather than having your horizontal space cluttered up with a bunch of family photos, which I believe should be kind of limited, right? Not 10, I think 1 or 2 is very, very nice in a nice frame. But get a shelf. If there's a shelf area that you can utilize to get your family stuff off of, or anything off of the countertop, that's another great way to clean up that clutter.
Exactly. It's shelves. See, that's what I do.
Yes.
Andrea helped me. So there you go. All right. My next one is get your carpets and your floors cleaned regularly, and whatever that means. I mean, I think at least every 6 months, maybe, I don't know if there's whatever the recommended amount is, because there's a lot of activity on our carpets and our floors, and we just kind of get used to it. And I know we know it's, we clean it the best we can and all that, but it's amazing to me when we used to get our tile floor cleaned, we're like, already? I mean, it's already been 6 months. But you walk in on Monday and you're like, oh my gosh, it's like a brand new floor. It's not something that you should wait until it's so gross that you're like, we got to get this carpet cleaned. Like, we have to get our floors cleaned. It should be a regular maintenance thing you do, whether it's every 3 months, every 6 months. Just make it part of your regular maintenance of the office and schedule it and just do it, because you're going to be happy afterwards and go, we should have done that a lot sooner.
Yeah, and use a professional service.
Exactly. Yeah.
For sure.
Exactly. All right.
Awesome.
Okay,
well, this is not part 4. This is not
part 4. Oh, geez.
No more. I'm done with clean up the clutter.
I don't believe you, but go for it.
So I love plants. I love greenery. I think it sets a great tone, but I think the problem that we end up with live plants is that we end up with bugs and not healthy plants. They're sparse, or they have dead leaves, or they've got dust on them, or Sometimes they'll even smell a little bit, you know, because the soil doesn't dry out or whatever. So I really caution against getting a lot of plants in an office. I'm a big believer in fake plants. I've got a black thumb, so that's a fake plant right there. Although the little one's a real one. I'm keeping that. I mean, they just, I'm always hesitant to see it. The ones that I've seen that can have done it successfully always have a service that comes in either weekly or bi-weekly to take care of the plants. And they clean them up and dust them, and they do look nice. But always really pay attention to that, especially the bugs.
I agree. I have my fake plant too, so we're good.
Yeah.
Actually, there's my fake plant. There's my orchid that's currently dying.
I'm sure it's perfect.
All right. So again, I'm kind of going on the back end of Andrea when she's talking about sinusitis, but mine isn't necessarily about the signs, but it's more about stop trying to sell everything to the patients from signage, like Oral-B and Sonicare and Invisalign and all of the things we do is amazing. And we need to have brochures and we want to educate our patients, but they don't have to all be out. Right. You don't have to have them all lined up. It's confusing, it's cluttered, and that isn't going to sell the patient on something they need. Your communication on the importance of home care or the importance of, you know, Invisalign and straightening their teeth or whatever it is you want to talk to the patient about, get the brochure and have the conversation with them. But lining them all up, I think we forget and we don't see it, right? And we don't realize that I have 7 different toothbrush brochures out and I have all the Sonicares and all of that. That's not helping you sell the product. So get rid of it and actually have the conversation and use the tools when you need them.
They're going to respond better anyway.
Exactly. So, okay, 27. Awesome. I see it.
All right. So kind of piggybacking on the last one about plants and limiting the plants, I do love fresh flowers. So fresh cut flowers in the office can be a really beautiful marketing tool. First of all, patients love it. They love seeing these fresh flowers. It can be, I've seen offices set up deals with a local flower shop that the flower shop has their card on it. And then they'll come and trade it out every week. Or where the office will provide logoed coffee mugs to a flower shop, and then the flower shop will deliver a fresh little bouquet that's time. And they'll have that on their countertop, and then at the end of the week, instead of trading it out, they'll give it away to a patient of the day, somebody that they really enjoy seeing. And the patients love it. I've seen patients come to tears because it's one little thing that has brightened their day, and it's such a simple, inexpensive thing. So fresh cut.
And the majority of decisions are made by the females in the household, right. And we love flowers. So
that's right.
Okay, good.
Exactly.
So my next one is about having refreshments for your patients. And just like when Andrea said, company's coming, one of the first things that I do when company comes is, can I offer you, even if it's water, can I offer you a cup of coffee? Can I offer you water? I don't think that we need to have a big spa environment and all these everything over the top. If you have that, that's fine. But at a minimum, there should be a place that a patient can get a cup of coffee. If somebody's with them and they're having to wait because the patient's in the back, they should have the ability to get coffee or a water. I'm not a huge fan of a lot of juices, of course, because of the sugar and the mess that they make and the kids and all that, but water and coffee at a minimum. And even if you don't have space in the reception area, take it another notch and say, hey, can I get you a cup of coffee, and have a coffee pot in the break room and go back or in the kitchen and go offer them a coffee. But it's just a nice touch and it's easy to do. And again, it's upping that feeling for the patient and their guest if they're waiting for them in your reception area.
Awesome. So true.
All right, number 29.
All right. So mirrors are a really, really great way to bounce light around a room. So if you have trouble with a dark reception area or a dark treatment room or something like that, oftentimes having a mirror in place, especially in the hallway, I think as patients are exiting, I think is a very nice place to have a mirror, because then they can check, make sure that there's no alginate on their face, although hopefully you told them they have alginate on their face and help them get that off. But occasionally, I think people like to see that they don't have anything going on their face, and they'll be walking out in public and not be embarrassed an hour later when they find that random piece of prophy paste on their neck or something like that. So I think it's really a nice touch, and it can really help brighten up a space as well. So mirrors are a good idea.
Yep, it brings in the natural light from the maybe the few windows that you have. Yeah, and their hair gets all messed up laying in the chair.
Yes.
And feel better.
Yep.
So good. Okay, so mine is, I'm going to get into a very sensitive topic, room, and I'm going to talk about the bathroom. I judge businesses on their bathroom. I judge, if you think about, you go to restaurants, I judge the restaurant on how clean the bathroom is. And a lot of dental office bathrooms just they're not nice. They don't smell nice. They're very clinical. They're very gross. And they're judging us on that. So give your bathroom some love. Make sure, throw a pretty picture on the wall. It doesn't have to have a picture of a toothbrush. Put a flower picture up, like behind Andrea or behind me. Have something nice in there. Have it stocked. Make sure it stays stocked, because there's nothing more embarrassing than having to go, there's no toilet paper in your bathroom, if they tell you at all. And have the necessities of what patients might need when they're in there, because especially a lot of our bathrooms tend to be like off the reception area, and it's already kind of awkward. So we want to make it as comfortable as possible for the patients. And the last thing, I'm just going to go there, I'm just going to say it, have a nice looking plunger in there, because God forbid something happens. People want to try to fix it. Don't make the ugly one in the corner, but something nice where if they had to, they could solve any dilemmas that they have when they're in the bathroom.
That's right.